Coming to VAlproate toxicity. VAlproate sodium IV. It is used to treat GTCS, absence seizure, partial complex seizure and post-traumatic epilepsy. It is also useful in migraine headache prophylaxis, to control mania in bipolar disorder, and in the treatment of neuropathic pain. It affects neurotransmitter and function of the electrically excitable cells. It increases GABA, reduces release of GHB and blocks NMDA. Valproic acid prolongs recovery of inactivated sodium channel, enhances potassium conductance and reduces T-type calcium firing. So increases GABA, gamma aminobutyric acid, reduces GHB, inhibits NMDA, inhibits calcium channels and inhibits sodium channels, prolongs recovery of inactivated sodium channels, inhibits sodium channels. With the standard preparation and therapeutic doses, peak serum concentrations are within 4 hours of after ingestion. Valproic acid is metabolized by the liver by glucuronic acid conjugation and mitochondrial beta oxidation. Valproic acid is metabolized by glucuronic acid conjugation and mitochondrial beta oxidation. It enters mitochondria using L-carnitine as a cofactor. Protein binding is extensive and influenced by serum concentration, with 90% of the drug protein bound. The half-life of valproic acid may be 2 or 3 times longer after overdose. What are the clinical features? After an overdose, the most frequent sign is CNS depression, ranging from drowsiness to coma. Other findings are respiratory depression, hypotension, hypoglycemia, hypocalcemia, hypernatremia, hypophosphatemia, and an iron gap metabolic acidosis that may persist for days. Toxicity to liver produces elevated serum aminotransferase, ammonia, and lactate. Pancreatitis may occur and thrombocytopenia may be seen. It increases renal ammonia production and blocks hepatic ammonia metabolism, thus increasing ammonia. Cerebral edema has been associated with acute overdoses. Valproic acid induced hepatotoxicity may be either intrinsic and benign, reversible, reproducible, and dose dependent, or it can be idiosyncratic and fatal. Children less than 3 years of age who are receiving multiple anti-epileptic agents and have additional medical problems are at highest risk for fatal hepatotoxicity, with an incidence of about 1 in 500. Therapeutic valproic acid concentrations are 50 to 100 micrograms per ml. Although serum concentration does not correlate well with seizure control or toxicity, adverse side effects are seen above 150 microgram per ml. Coma may occur over 800. Valproic acid is eliminated partly as a ketone body and may cause a positive test result for ketones in urine or blood. How do you treat it? Single dose activated charcoal alone is sufficient for the vast majority of patients of valproic acid overdose. Consider multi-dose activated charcoal or whole bowel irrigation after ingestion of enteric coated or delayed release preparation. Overdose patients have been given L-carnitine as an attempt to increase valproic acid metabolism by beta oxidation, and this therapy increases the resolution of coma, prevents hepatic dysfunction and reverses mitochondrial complication. So how much L-carnitine to give in valproate toxicity? Administration of L-carnitine 100 mg per kg IV initially, then followed by infusion of 50 mg per kg IV TDS is recommended in case of valproate toxicity and patients with lethargy, coma, increased ammonia and liver dysfunction. Then hemoperfusion and hemodiafiltration has been used to treat serum valproic acid overdose. Although valproate is not amenable to dialysis due to 80% protein binding, significant protein binding, free drug is markedly increased in overdose, and removal of valproic acid from stool appears beneficial. Elimination half-life is decreased by 2 to 7-fold. During hemoperfusion hemodialysis, it decreased by 2 to 7. Universal use of hemodiafiltration cannot be recommended for all patients. Then there are other first generation anticonvulsant, ethosuximide, methosuximide, प्राइमोडोन, फिनोबार्ब, है ना, जैसे कि ये हो गई आपकी सेकेंड एंड थर्ड जनरेशन, ब्रेवासेटैम, दुनिया भर की दवाइयाँ हैं.